Hello and welcome to this presentation on the impact of COVID-19 pandemic on three key groups: healthcare workers, educational institutions and students, and economically vulnerable populations. Let's start with healthcare workers. In the UK, the COVID-19 pandemic exacerbated pre-existing issues within the healthcare system. Chronic underfunding and staffing shortages were already significant problems, and the pandemic brought these issues to a crisis point. According to the Office for National Statistics, there was a substantial increase in stress and burnout among healthcare workers, with many considering leaving the profession due to increased workloads and insufficient support. This has been further corroborated by a survey indicating a significant rise in vacant NHS posts, contributing to a severe staffing crisis that impacted patient care delivery. This created a big problem as there is a steep rise in vacancies and the corresponding increase in stress levels among healthcare workers. So, as for educational institutions, the shift to remote learning due to school closures in March 2020 and January 2021 highlighted a significant digital divide. Students from lower socio-economic backgrounds struggled with inadequate access to digital devices and reliable internet, leading to significant learning losses. For instance, 50% of teachers in the most deprived areas reported that their students were completing less than an hour of work per day. Furthermore, up to 21% of households with children, where the main earner was in semi-skilled or unskilled work, had no home access to a laptop, desktop or tablet. Additionally, 6% of these households had no internet access and 9% only had smartphone internet access. Lastly, the economically vulnerable populations were severely affected by the pandemic. The economic downturn led to widespread job losses and increased poverty rates, disproportionately impacting those already financially unstable. A study by Collard et al. Found that around 3 in 10 UK families with children were living on a lower income in January 2021 compared to February 2020 due to pandemic-related loss of earnings. This situation has exacerbated existing economic inequalities, highlighting the need for a robust social safety nets to support these populations. The pandemic has highlighted and intensified existing issues within healthcare, education, and the economy. Addressing these problems requires systemic reforms and targeted policy interventions. In this section, we'll synthesize the evidence to better understand the impact of COVID-19 pandemic on these three key groups. Evidence shows that the burnout and mental health challenges among healthcare workers have significantly increased during the pandemic. According to a British Medical Association survey, 53% of doctors reported deteriorating mental health due to insufficient staffing, and 41% experienced higher levels of fatigue. These findings are consistent with other reports highlighting the chronic underfunding and staffing shortages that plagued the NHS even before the pandemic, exacerbating the stress and burnout experienced by healthcare workers. Educational disruption has also been a significant issue. Research indicates that the shift to remote learning resulted in substantial learning losses, particularly for students from disadvantaged backgrounds. During the first lockdown in spring 2020, nearly 74% of private school pupils benefited from full school days compared to only 38% of state school pupils. Estimates indicate that primary school children were around 2 or 3 months behind previous cohorts in reading and maths by the autumn term of 2020. The economic impact of the pandemic has been severe, with significant increases in unemployment and poverty rates. Economically vulnerable populations have been hit the hardest, with long-term implications for economic inequality and social stability. The UK's response included measures like the Coronavirus Job Retention Scheme and Self-Employed Income Support Scheme, which collectively cost £83 billion in 2020 and 2021. with additional welfare support costing £8.3 billion. And despite these measures, approximately 3.8 million workers were estimated to have not been eligible for these support schemes, highlighting gaps in the social safety net. The evidence here underscores the extensive impact of the pandemic across different sectors. The data highlights the need for comprehensive policy responses that address both immediate and long-term needs, providing critical support to healthcare workers, students, and economically vulnerable populations. To fully understand the challenges exacerbated by the COVID-19 pandemic, we need to examine the systemic issues that predate it. Chronic underfunding and staffing shortages have long plagued the NHS. The pandemic highlighted these deficiencies, with reports from the British Medical Association indicating that the NHS entered the crisis with significant deficits in resources and capacity. This lack of preparedness led to high levels of stress and burnout among healthcare workers. Many considered leaving the profession due to overwhelming workloads and insufficient support. Additionally, a report by Gainsbury noted that NHS spending plans often fell short of the required growth rates, further exacerbating resource constraints. In the education sector, socioeconomic disparities significantly affected students' ability to participate in remote learning. The digital divide was a significant issue, with Ofcom data showing that children in lower income households were more likely to lack internet access and access to a digital device. 1 in 5 children from the most financially vulnerable households did not have consistent access to a device for online learning. This lack of access exacerbated educational inequalities, and this was another pre-existing issue that the pandemic intensified. The economic recession led to significant job losses and income reductions, particularly those in precarious employment and low-wage jobs. This lack of a robust social safety net further exposed economically vulnerable populations to financial instability. Reports from the Care Quality Commission stress the need for comprehensive social support systems to mitigate these adverse effects. Addressing these root causes requires systemic and long-term solutions. In healthcare, this means substantial investment and reform to address funding and staffing issues. For education, bridging the digital divide necessitates targeting support for disadvantaged students and significant investments in digital infrastructure. Economically, expanding social safety nets and implementing policies that promote job security and fair wages are crucial steps towards reducing poverty and inequality. By assessing these underlying issues, we can develop effective strategies to mitigate the pandemic's impact and build a more resilient society. In response to the complex challenges posed by the COVID-19 pandemic, we need a range of policy measures to address both immediate needs and long-term resilience. To support healthcare workers and improve our healthcare system, we need to increase funding and resources for the NHS. This includes implementing comprehensive mental health support programs for healthcare workers to address burnout and stress. Additionally, reforming the healthcare system to enhance efficiency and resilience is critical. This might involve adopting new technologies and improving workforce planning to ensure adequate staffing levels. In education, significant investment in digital infrastructure is essential to bridge the digital divide. Providing training for educators on effective remote teaching methods and ensuring disadvantaged students have access to digital devices and reliable internet are crucial steps. Developing hybrid learning models that combine in-person and remote education can help ensure educational continuity and mitigate learning losses during future disruptions. Economic support measures are also vital. Expanding social safety nets to provide immediate relief to those hardest hit by the pandemic should be a priority. This includes increasing unemployment benefits and providing direct financial assistance to low-income households. Additionally, job retaining programs can help displaced workers acquire new skills and re-enter the job market. Supporting small businesses and vulnerable sectors through grants and low-interest loans can promote economic recovery and stability. These policy responses must be informed by comprehensive evidence and tailored to address the specific needs of different sectors. By leveraging a wide range of policy reports and evidence, it's clear that targeted interventions can mitigate the adverse effects of the pandemic and promote long-term resilience. However, these measures must be part of a broader strategy that includes systemic reforms to address the root causes of the challenges exposed by the pandemic. However, with that in mind, it's crucial to focus on the most impactful policy response to address the challenges exacerbated by the COVID-19 pandemic. Our priority recommendation is to expand social safety nets to support economically vulnerable populations. This policy addresses immediate economic pressures and promotes long-term economic stability and social equity. To illustrate the need for expanded social safety nets, let's consider recent findings from the New Economic Foundation. Their analysis reveals that people on universal credit could have been up to £670 worse off in April 2024, even if rates rise in line with inflation. This reduction significantly impacts single individuals, lone parents and families, with lone parents seeing a cut of £350 and couples with children experiencing less benefit increases. This graph demonstrates the predicted shortfall in benefit income for various household types, emphasizing the inadequacy of current social safety measures. The long-term benefits of expanded social safety nets are substantial. They provide a buffer against future economic shocks, offering stability to those at the lower end of the economic spectrum. This stability reduces the financial strain on the healthcare and educational systems, as individuals are less likely to face severe consequences from economic hardship. Reducing economic inequality fosters social cohesion and stability, contributing to a more resilient society. The analysis also highlights that 40% of all families will be unable to afford the cost of living by April 2024. This rate remains the same as April 2023, but represents a 10 percentage point increase since April 2019. Underscoring the persistent nature of the cost of living crisis, for the poorest quarter of households, the shortfall between income and essential living costs will increase by £430 a year, assuming benefits are only uprated with inflation and cost of living payments are discontinued. Comparative analysis of policy effectiveness further support the expansion of social safety nets. Nations with comprehensive social safety nets have demonstrated better resilience during economic downturns and faster recovery rates. Incorporating robust social safety nets as a policy priority addresses both immediate and long-term challenges, and this promotes broader economic and social stability. So, thank you for listening.